In the United States, environmental justice is defined as all people, regardless of background, having equal access to laws regulating environmental pollution and protection from environmental hazards. We are still fighting the battle for environmental justice. A key data point that reflects this is the disparity in life expectancy between African Americans, indigenous peoples, and other races that has persisted in the United States for centuries. Across demographics, women are found to have longer life expectancies than men. White and Hispanic Americans are found to have longer life expectancies than African Americans and Indigenous Americans. This disparity in life expectancy is caused by compounding factors in the United States: history of racism, discrimination, ongoing economic forces of capitalism, and failings in healthcare. A large disparity that is widely discussed is the longer life expectancy for women than for men. Life expectancy is calculated as either the mortality rate for an age group or the average age of death for an entire population. Some biological factors contribute to the longer life expectancy of women compared to men. There is also a higher mortality rate for men under the age of 65 compared to women. Life expectancy disparities exist across the United States. In 2019, life expectancy in DC was higher than all 50 states for white men and white women at 85 years and 88 years respectively, but lower than all 50 states for African American men and women with a life expectancy of 66 years and 76 years respectively. According to this data pulled from the 2020 census, this is a result of multiple factors: poverty, increased stressors derived from it are in part responsible for this disparity, but they are not the sole factor driving the disparity in life expectancy. There is a direct link between built environments and their effect on health and life expectancy. Sources of air pollution and aging community infrastructure, such as schools and housing, are directly linked to aggravating conditions such as asthma, which increases mortality. Due to social migrations from deindustrialization and white flight, divestment from urban communities that are predominantly non-white has exacerbated this stressor on communities of color. Community healthcare systems can also suffer from divestment in both urban and rural settings. As the United States sees populations concentrating around urban areas, rural Americans are most affected by a decline in healthcare services and quality. The example of diabetes treatments, which impacts the rural Americans at a slightly higher rate. Diabetes self-management programs are generally reimbursable by insurers such as Medicare. However, under the current paid service model, 62% of rural counties lack any diabetes self-management program, and existing programs tend to be located in rural counties whose populations have higher incomes and more education. Now, education, income, and socioeconomic status are not the only factors responsible for the disparity in life expectancy between African Americans and other groups. When controlling for the factors listed on the screen here, about 70% of the disparity in life expectancy is eliminated between African Americans and white Americans, but that still leaves a large disparity in overall life expectancy. One shocking example of this in discrimination's history is in Houston, where air quality is worsening in communities of color, and they are facing ozone levels above federal standards at an increasing rate, while predominantly white communities are not facing these issues. This is a result of industrial emissions and concentrations of car traffic around communities of color. According to a National Institute of Health study, persistence of racial disparities and exposure to neurotoxic air pollution, even after accounting for socioeconomic inequalities, has shown that there is disproportionately concentrated air pollution around Black and Hispanic families in communities with a higher burden of pollution. This leads to higher rates of morbidity or forced inactivity due to health issues. Morbidity is a leading driver in early mortality and causes a lower life expectancy for communities afflicted by this pollution. In conclusion, socioeconomic disparities, failing healthcare systems, discrimination of how pollution is spread out, and environmental racism has led to disparities in life expectancy.